second leading cause of gynecological cancer in developed countries, including the United States. It's third in the world. We have probably around 24,000 new cases a year with 14,000 deaths every year. Is the most common cause of gynecological cancer in the United States. It's an extremely important topic. But today I don't want to give you so many numbers and try to make a scientific debate or evidence-based medicine. I think we have to take a look, what does it mean, all these numbers that we discussed and you guys doing the test for the patient. I think even though a lot of humanism has been introduced to medicine, we go between being a scientist and a researcher, but at the end, and I'm telling this not only to the medical students, I'm telling them to my MAs, to the front desk staff, we taking care of the patient. We do not exist, and we should not exist if we do not have patients. So for you guys, if you do this medicine, whatever that might be, the primary role is for us to take care of the patient. And we have to listen to that. We don't have all the answers, and sometimes, listen to the patient is one of the most important things that you guys can acquire through your medical school and later, of course. So I think this time I'm going to like to introduce, Amanda to talk to you about, the National Ovarian Cancer Coalition and to explain their role. And next we're going to go to each individual survivor and tell their story. We will appreciate having you here through the storm, through the wind, through high working wind, our loss, and they're here. So that shows determination, and I just would like to share the story with you. So I appreciate if you guys ask questions. I think it's an open forum. I have to go understand what they've been through, and just try to cooperate so you can learn something from this event. I know it's a requirement for you guys to be here, but just make the most of it. Okay? Thank you. Okay, so I'll let you Amanda from the National Ovarian Cancer.
Good morning, everybody. So my name is Vonda Soldati, and I have one of my coworkers, Jen, from the National Ovarian Cancer Coalition. We're a non-profit group that's been in existence for about 25 years, and our mission is to raise funding for ovarian cancer research. We have a partnership with Stand Up to Cancer, and then we also really work to promote education on ovarian cancer and allowing or giving women a voice to advocate for themselves and build awareness. So like your professor said, what makes ovarian cancer different from other cancers is, if you haven't learned this already, there's not really a early diagnostic tool that provides the results that are valid. There's a lot of false positives, a lot of false negatives, so it's not something that's prescribed for the general public. If you've heard of something like a CA-125, that's not something the general public will have done to see if they have ovarian cancer. And a lot of the symptoms of the disease are usually benign. They're going to be ruled out as GI issues and everything before that, before you're going to get to maybe looking at cancer. But that's kind of changing. So that's what we do. We've been coming to Robert Wood Johnson for about 6 years. We do this every year. It's a great day for us. It's a great day for the ladies because they feel that it's a way that they can kind of give some more personal information. Like the professor said, not just the numbers. You're going to hopefully start learning that not every protocol fits every patient that you're going to start working with. Not everybody's going to align themselves with the statistics that you read about. So we handed out a little pamphlet or a little piece of paper that gives you a little brief synopsis of each of the 3 ladies here. At the end, they're each going to give about a 5-minute introduction and try and tell what has been going on with them for some of them over a decade in about 5-10 minutes. And then it's open to you to ask questions. There's no question that's off limits. We have gotten every single question imaginable over the last 6 years, so please don't be shy about asking what might pop into your head. And at the bottom of the flyer, there's just some of our main events that we do. If you want to volunteer, if you want to come out, there's information for myself and for Jen, and there's events all over the country. If you have to do community service hours, please get in touch with us about that. So Tina is actually going to start. Tina has been one of our ladies that's been here since day one, so she will tell you a little bit about herself.
Thank you, Vonda. Good morning. Good morning. Everybody awake? I know it's early, it's a Monday. It sucks. But we gotta be here anyway, right? You gotta do what you gotta do. Anyway. So, my name is Tina. 17 years ago, I became a part of a community that I never wanted to be a part of. I was diagnosed with stage 3C ovarian cancer. For years, I had been suffering from symptoms attributed to this cancer, but because there was no early screening and the symptoms mimicked that of other health issues, my concerns were ignored and diagnosed as other ailments, and at one point, even psychological. I have been through a total of 6 surgeries. I have had over 150 stitches, only 3 partial chemotherapy treatments out of 6, and I've coded 3 times during my journey. During my chemo treatments, I landed in the emergency room with loss of my vision and paralyzed from the waist down. And on my first treatment, I experienced a severe allergic reaction that shut down my lungs and my heart stopped. I had to end my treatments early for fear that it would have killed me. Today, my new life is full of chronic pain throughout my body due to the nerve damage caused by the surgeries, neuropathy, and I've also been diagnosed with severe fibromyalgia. I've been forced into early menopause that will last the remainder of my life. I suffer from side effects left by the chemo treatment. My memory at times can be challenging. Remembering the day before can be hard at times. Ovarian cancer does not just affect women. It affects our families, our partners, and our close friends. I only had my husband, caregiver, at my side. Many others chose to abandon my side because of lack of knowledge that comes with this cancer. A support system is key to fighting this cancer and many others. The stigma that this is just a woman's disease is not so. It affects us all. I also did not have the best or most compassionate of doctors. I was once compared to a car, how the hood had to be opened up, and not once was I looked at while this was being said. He constantly looked at my husband. My oncologist was no different. She never gave me much hope, and when I decided to quit my chemo, she said, "I'm not your camp counselor. Do as you please." My doctors gave me 6 to 8 months to live after that. But 17 years later, I'm still here. I do not share my life with ovarian cancer for sympathy or a pat on my back. I share it so that others can learn from it. Because my life was spared, it has become my mission to advocate for all women. I believe we must learn to listen to our body, learn to speak out when doctors quickly shut us down, seek outlets that will empower us to learn as well as strengthen when diagnosed with ovarian cancer and any other cancer. Learn to fight, live with it, and fight life after it. It's also important for doctors, nurses, and all health care professions to remember and or understand that we are not all the same, and one protocol cannot work on each other. Every one of us is different. Thank you.
Mary. Yeah. I'm not used to talking on the mic, so. My name's Mary. I'm a 5-year cancer survivor, ovarian 3C. I'm 65 years old, and up until then, I was, sorry, perfect voice. I was healthy, hiked, camped, traveled, bicycled, and I worked full-time as an RN in the operating room in a local hospital. I was the head of the orthopedic department, so I didn't really know a lot, excuse me, about GYN surgery. I started getting a nagging, pulling pain in my abdomen, not really acute, but you know, it was there. And I don't know about medical school, but in nursing school, you tend to get every disease that you're studying. When you're out of school, you kind of let that go and you self-diagnose and you self-treat. And I did that a lot, but I didn't do that with this. I, for some reason, knew that I needed to go for help. So I went to see my family doctor. I saw my GYN doctor, my urologist, nutritionist. I did hallway consults with anybody I could see. And I had all kinds of lab work done, x-rays, ultrasounds. People listened to me, and they did do tests, but I was worked up for a million things, just like everyone with this disease. They thought it was a small bowel obstruction, pleurisy, diverticulitis, and I had all these tests, and all the results came back as menopause or constipation. Couldn't really find anything. So I tried increased exercise. I tried to change my diet. I did yoga. I tried meditation. I tried gluten-free, dairy-free, high fiber, low fiber, chia seeds, flaxseed, fasting. I took probiotics and vitamins. But it kept coming, nothing worked. So after about 6 months of this, I went back to my GI doc, who, thank God, believed me and stayed with me and said, let's do one more CAT scan. You know, maybe you have chronic appendicitis, I don't, let's try again. So I worked all day, went home, got the CAT scan, went home, and about 9:30 that night, he called me and said, it's not appendicitis. Oh, good, I'm glad. He said, no, call your GYN doctor, you need to see him. And I wasn't worried, because I had CAT scans, I had the ultrasounds, I had blood work. And so I went to bed, got up the next morning, went into work, 6 o'clock in the morning, it's early, I'm finding up the OR, I look for a computer, because I can look up my records. Right? So I go on the computer, and I read large volume of peritoneal tissue, characteristic of extensive peritoneal carcinoma, obscured organs, and my very favorite, shaggy rind of neoplasm. I thought this was going to be dead by the end of the year, but I had surgery a week later. I had 2 recurrences since then. I've had a remission. I had my surgery, I had chemo, 18 weeks. I had a 14-month remission, and I recurred, which was worse than hearing it the first time. Then I had chemo again. I had another remission. I recurred again, and now I'm on remission again. So, what I want to remind all of you is that, how many of you plan to go into GYN or oncology? And a lot of you don't. Just remember that you might be the one that finds it, my GI doctor. So keep in mind that not every 60-year-old woman that has abdominal issues is necessarily full of good Thank you.
And now Colleen. Good morning, everyone. I just want to say I'm honored to be here with you this morning. My name is Helene Charlotte Unger. I'm 52 years old, and as of next month, it'll be 2 years since my chemo ended. So it's still very recent. And like the other two ladies, Tina and Mary, the path to my diagnosis is a little bit different. So I did a little bit of a sequence of events for you. August 2016, I was hospitalized after an ER visit with shortness of breath and pain under the right clavicle, which was spreading around to my back. I was diagnosed with DVTs in the right leg and multiple pulmonary emboli. I was on heparin at the hospital and given Xarelto upon discharge. My follow-ups were with the pulmonary physician and a hematologist. I spent 4 days at St. Barnabas Hospital, and I was discharged home on a Saturday and returned back to work on Monday. At that point, there was really no discussion about anything other than just what was the cause of the DVTs. While at the hospital, there was a lot of question about whether or not I was a smoker, whether I had traveled recently, whether I was on birth control, and it just kept circling around the typical questions about someone with a DVT. And I'll get into a little bit further why those questions were just not applicable to me. There was one pulmonary physician who walked into the room who I truly admired and respected, and he said, "I don't want to scare you, but have you had recent tests, mammogram, pap smear," and asking me about my recent tests. He said, because sometimes DVTs could be indicative of a cancer. At that point, I had not had recent tests, but of course, I really didn't want to hear that type of a statement. Approximately 10 days later, after I had returned home, I was in the ER again at St. Barnabas with severe pelvic pain. It was excruciating. 24 hours later after that visit, I returned back home and I went to the regular gynecologist based on their recommendation. There was blood work done, and I was then notified by phone about a week later that the result was indicative of high risk of cancer, and I was referred to a gynecological oncologist/surgeon. And to this day, unlike Tina, I admire him truly, and I don't know honestly what I would have done without him. He's fantastic. During my visit with him, orders were given for additional blood work and a vaginal ultrasound. I'm going to add that this test was offered to me at the hospital, and when the woman came out to me with this big wand in her hand, I looked at her and I said, "What do you think you're doing with that?" And I refused the test. So it's not that they didn't offer it. And my husband wasn't too happy with my being adamant against that. During that time frame that I was waiting, the results of stated tests, the pain on my right side had increased exponentially and became intolerable, especially when I was lying flat. I had many nights of screaming in the middle of the night in pain. And my husband, who's here with me today, he honestly didn't know what to do. I took some pain meds, but nothing was effective. I had returned to the pulmonary physician during that time, and there were no further concerns after the pulmonary emboli or the DVTs, so that everything else was apparently fine after that hospitalization. Once the test returned, my husband and I were called to come and meet with the doctor, and he had recommended surgery to remove the cyst on my ovaries. We did talk about the possibility of a malignancy, which I didn't really put in here, but we still were feeling very positive that this surgery would only be a couple of hours, and we were thinking, of course, the best case scenario. He did go over what the worst case scenario was, and at that time he said that, you know, there could be a possibility if the cancer had spread, if they were, you know, if there was a possibility of cancer, if it had spread, there was a chance that they would do a
a colostomy bag. And I said that I honestly didn't care what they needed to do, but I would not be walking out of there with that. And I told him not to do it. So I said I'd sign up until, that he could do anything he wanted up until that. The pain continues to worsen during the time that I waited for surgery, but I would not call and schedule the surgery sooner because I felt like I had to do certain things before the surgery, things that might not be important to anybody in this room, but at that time I had to keep some control over my life. So I had a gala to go to, I had things to do for work, and I just felt like I could get through the pain until I got to the surgery. So at that point in time, where my life was spiraling so far out of control, I maintained what little control I had left in my life, and I sustained the pain at night, but I still got through the days. Symptoms that were noticed prior to my actual diagnosis: I had bleeding throughout the months, which had increased leading up to the surgery, kept getting worse. I had chalked all that up to menopause. I never really read much about it, but I figured this must be all part of it. I'm just gonna suck it up. Frequent urination, and I had some leaking of urine, which I really never told anybody. I was kind of embarrassed. I had severe exhaustion. It was difficult to differentiate from just being tired from running. You see, I'm an avid runner, and 6 months thereabouts prior to my diagnosis, I had run a 50-mile ultramarathon and completed it. And then 1 month prior to that, I had completed a 30-mile race. So tired was part of my life. I didn't think it was anything unique to be severely exhausted. I had frequent bloating that was also often impossible to hide. I wore fitted dresses most often, and I kept jackets and baggy sweaters with me at times because sometimes my abdomen would automatically just like pop out all of a sudden, look like I was having a baby or something. So I would just throw over the sweater and just keep my hands folded across the front to avoid that from looking, from being noticeable. I also had pain during intercourse, which created a whole host of other issues emotionally. So I just didn't think that was anything abnormal. I just thought, whatever, it was something else. And I never wanted to tell anyone that. Obviously, that was embarrassing as well. Constipation, like Mary said, had become more severe over the past 15 months. And it wasn't just, what I could consider normal. I mean, over the years, of course, everyone has some type of bout with that. But this was debilitating. My athletic performances have also declined. I was pretty much an avid racer from 2007, often running speeds of about, 7:20 per mile pace. And I had been dropping down significantly, and I just kept thinking that, I was growing older and I couldn't really beat Father Time, so to speak. So I often pushed myself harder. I changed my training regimen to 2 times a day instead of once. So where I was feeling more tired, I just kept driving harder. I also noticed my hair was thinning out, and although my hair is pretty much back to what it was prior to losing it, my hair was part of my personality. And to have it coming out in clumps in my hand, even before I had the chemo, I knew something was a little off. So I had a total hysterectomy, as well as, and I hope I'm saying this right, omentectomy. It showed cytological peritoneal washings were positive for metastatic disease. Chemo was advised. It was determined both cancers, I had endometrial and ovarian, were stage 1. I had 6 cycles of chemo between 12/16 and March 31st, 2017. After chemo, I was referred to a radiation oncologist, and it was determined that radiation was not required. it's a darn good thing, because I was all guns ready to go in there and tell her it wasn't happening anyway. So she started off the discussion by saying, we're gonna do this backwards today, Helene, okay? She said, you do not need radiation. And I said, great, conversation over, I'm out of here. So, thank God. Prior to the surgery, I had an IVC filter inserted, and it was removed after the surgery. When the IVC filter was removed, the port was inserted. Lots of procedures building up to the surgery, and each one of them provide a whole host of emotional issues and physical problems. The port to me was honestly the worst thing of all. This thing underneath your chest sticking out, I was terrified of it, and I never really got used to it, and I made sure they took it out so quickly after the chemo was over. After the chemo stopped, March 31st, 2017, genetic testing was done, and Lynch syndrome was found. If you don't know what Lynch syndrome is, that's a whole new thing. So apparently I have a genetic predisposition now to several other cancers. I was advised to have yearly colonoscopy, annual skin exam, and yearly urine test. So the follow-up has been quarterly visits to the oncologist and a review of the CA-125, 6 months CAT scans, and after 2 years, I have actually graduated to 6 months checkups with the surgeon. Anticoagulants discontinued in July 2017, and I haven't had any issues. Another damn good thing, because I'm a trail runner and I'm prone to falls. At this time, there is no evidence of disease, and there hasn't, thank God, in 2 years, been any recurrence. Prior to illness, I had maintained a very healthy lifestyle. I ran hundreds of races since 2007. To date, I have participated in 50 half marathons, 4 full marathons, 2 ultra marathons, mountain races including Mount Washington, high hill running, multiple mud runs, trail races, snowshoe runs, and fun runs. So clearly, I did not fit what people would think. And often people would come up to me and say, I can't believe you got cancer. You're so healthy. You've done all of this. How could you possibly have cancer? I felt the same way. But with the help of my friends, the NOCC, my husband, and my family, I plowed through this like I would plow through any race in life. And I feel strong today. I'm back to running. I do boot camps, and I feel very fortunate to be able to advocate for those who, when a physician or someone would look at them and think this could not possibly be. It did happen, and I am grateful, actually. This is going to sound pretty crazy to you all, but the blood clots led to the path of the cancer. Thank you.
The genetic testing, so any family history in the
I have an aunt on my mother's side that had ovarian when she was younger. But the one thing that I want to say about ovarian cancer that I've learned throughout the years since I've been involved in the community about this is that ovarian cancer not only comes from your female side, it also comes from your male side. So when you're talking to your patients and you're going through their history, you always have to remember that it's on both sides. And that's where a lot of patients do not know that if your father had colon, pancreatic, that means that you can develop some kind of cancer, whether abdominal, gynecological, or anything like that. So it's very important that when you're speaking to your doctor or when you're speaking to a patient that you get all the medical records from both sides.
I agree with that. Actually, physicians do not know that also. Just going to side. Actually, it was another interesting thing that I didn't think that, but maybe because we're going to deal with the recurrence of ovarian cancer. You said that the recurrence was worse than the first diagnosis, emotional.
Yes, absolutely. The first time I was diagnosed, I was just in shock. I don't think I really processed it until late. But I went through the diagnosis, I went through the treatment, I had a lot of support from family and friends, and then I went through the chemo, and even though my oncologist was very honest with me, he did tell me that there was a great chance of recurrence, and it kind of avoided research initially because so much of it was bad. So I didn't really want to know that. But when it came back, I was devastated, and I'm not really sure why. Just knowing that I had to go through the hair loss and the chemo again, and the fatigue and the nutrition issues, I guess that's why. It was worse. The third time wasn't so bad. I don't know, I guess I kind of have accepted.
Definitely, if you guys have any questions, please ask, some things that I actually learned here just listening. It was very interesting what Ellen said about, that she felt her life is spiraling out, and out of control. So when we have this type of diagnosis, you have to think sometimes think as a physician, or you're gonna have this type of surgery, and you're gonna have this recurrence, and you're gonna have these outcomes and everything else. But for patient means more, means that they have a job, they have things that they enjoy, and they have, things that are part of it, they have families, they have husbands, and it's just a lot of that. It's a lot of the social loss that, sometimes it's very hard for us to quantify, and I think that's their role here. I always kind of try to imagine the patient's, side, so, if this will happen to me, we already maximize what to do, that it's just no easy to take care of yourself, There's no time, what are you gonna do with this, what are you gonna do with work, what are you gonna do with children, what are you gonna do with family, what are you gonna do with mortgage, what are you gonna do, so many things. So that was, because I already, listen, I'm so busy that I cannot be sick, but people do this. And we have to, from that perspective, understand when you make this decision for the patient, that you affect a lot of things, not only the clinical outcomes, but the social outcomes. And any questions, guys? Yep, yeah.
Thank you so much for coming and speaking today. I really appreciate you sharing your stories. So Helen mentioned a lot of specific symptoms. She listed them in terms of the hair loss and the need to go to the bathroom more and things like that. And I was wondering if you, Tina, and you, Mary, would maybe go through the specific symptoms that you experienced. In the beginning, a lot of them, you mentioned were benign, and missed, and a lot of these other things. Would you mind sort of listing, what stood out to you as the flags?
Sure. My symptoms were very vague. Mostly what I remember is, I work in the operating room, or I did, I had to retire. But mostly, when it started, I had a pulling under my right rib cage. And it wasn't bad, it was really bad if I laughed. So when I was laughing, I didn't even know I was doing it, really, my coworkers were, kind of pointed that out initially. And the other symptoms, it was GI. It was, I really, honest to God, I went in and said, I think I have a tumor. I think it's right here in my colon, because that's where my pain was. And I just, I had issues with my bowels. And and then finally, it started moving around my belly. But I didn't have the hair loss then, or any bloating. I didn't have the frequent urination. I didn't have any unusual fatigue. I just got that weird And so, you know, even though I have the test, I have CAT scans, I have an ultrasound, and like I said, the radiologist reported downfall of stool. You know, so I don't know why they couldn't see it. How it was explained to me was that the cancer was laying down cellular levels all over, but it wasn't, that they couldn't see it yet. And so, because I didn't understand, why am I 3C now? You know, why is it so advanced? And I had scans, and it was because it was laying thin layers of cells all over, and they couldn't see it until, you know, the last test.
With me, everyone has to remember that it was a long time ago. It was 17 years ago. So I was 30 years old. I'm now 47. So back in 2002, medicine in reference to ovarian cancer has not progressed as much as us would like it to, per se. And back then, I was misdiagnosed for 2 years. I had the bloating, which is the main thing, is the bloating. That is the main thing. I was going to the gym. I'm 30 years old, you know, going to the gym, having fun, whatever. And I could not get rid of this little belly thing that I had. Back pain. My periods were severe, really, really bad. But again, like Helene said, you're caught up in your world. You have a job, you know, I have a daughter. You go to work, you come home, you don't have time for anything else. So I did go see a gastroenterologist. I saw a psychiatrist because at one point I was the, everybody in the ER in my town kind of knew who I was because I was constantly going to the emergency room with pain, with a slight fever, with pains in my legs, all types of things like that, urination, everything that refers to it as a gastroenterologist symptom. Well, they called me a hypochondriac. They would kind of say, oh, she's okay, just give her IV, give her a pain medication, and send her on her way. So that's basically how it was. I spent 4 hours in the ER and I would go home.
Frequent flyer.
I was a frequent flyer, that's right, my husband just reminded me, people would call me a frequent flyer. So I was on Wellbutrin back then, antidepressants constantly, because again, everyone thought it was all in my head and everything was fine my body-wise. I did have tests done, but no CTs, no scans or anything, it was just blood work. The one main thing that is constantly our goal is to get a primary test for ovarian cancer. There is no test. You can't do a mammogram. CA-125s are normally they're not, for a lot of women, they're negative, even though you do have the cancer. So one day I woke up and I had my period. And it was so bad that my temperature actually went down, and I called my gynecologist. I'm like,